Hello and welcome to my series of discussions on medical related topics, and today I thought we'll discuss about diabetes under the section of endocrinology. Diabetes is a condition which exerts a significant burden towards the health system. According to the CDC, by the year of 2000, between the years of 2025 to 2030, they expect to diagnose about 300 million new cases of diabetes. So therefore, I think it is extremely important that the public, the patients, as well as the physicians are up to date, or at least have the knowledge about diabetes so that it could be prevented or managed successfully in the future and even at the present. So we will start our discussion with the following topics. We will discuss the definition of diabetes, then we'll discuss a little bit about the background of how pancreas plays a role in the insulin synthesis and its secretion. Then we'll talk about the types of diabetes: diabetes type 1, diabetes type 2, and the other causes of diabetes, for example gestational diabetes, drug induced, and then diabetes insipidus are some of the things that we will be discussing. And then we will discuss about how diabetes, some of the complications of diabetes which will include macrovascular as well as microvascular complications. So macrovascular complications would include their higher risk for ischemic heart disease, stroke, and the microvascular complications would be the diabetic nephropathy, neuropathy, as well as retinopathy. And then we'll discuss a little bit about the metabolic syndrome or syndrome X, and then the most frequent endocrine emergency, hypoglycemia, and then finally we will discuss about how we could help patients and people to prevent and manage diabetes. This could be done with lifestyle modifications and diabetic medications, as well as insulin, and also how we can do it with the combination of all of them. So let's first try to understand the definition of diabetes. So the word diabetes comes from the Greek language, which actually means to pass through. In the past, the differential diagnosis between, for example, diabetes mellitus and then diabetes insipidus was done by a medieval version of urine analysis, and it was done by tasting urine, and if it tasted like honey, it was coined as diabetes mellitus, because mellitus means honey in Latin, and insipidus, which meant tasteless, which also is reflective of the amount of or higher concentration of water in the urine. But as a definition though, we could consider diabetes as the lack or reduced effectiveness of endogenous insulin. So in situation where there is a lack or complete absence of insulin, you can understand that there would be an elevation of glucose in the body, and also if there is a reduced effectiveness of insulin, again there will be an increase in the glucose in the body, so therefore it causes what we call a hyperglycemic condition. So again, when there is a hyperglycemic condition which is prolonged for a longer duration, or which happens chronically, then it may induce microvascular as well as macrovascular complications. And I think sometimes considering its vast effects and implications on these the vascular system, it is also, I think, fair to consider diabetes as a vascular disease, but it mostly falls under an endocrine condition. So the symptoms of hyperglycemia would be polyuria, polydipsia, polyphagia, and unexplained weight loss. And sometimes unexplained weight loss happens even in the presence of polyphagia. Apart from that, you could also see visual blurring and lethargy. So you can always remember this little system here. We could call it the 3Ps weight loss. If you remember this, you can remember that the 3P stand for polyuria, polydipsia, and then polyphagia, and weight loss, of course, the unexplained weight loss. And then the V here stands for visual blurring, and L for lethargy. So now a little bit of background of insulin synthesis, and where it happens, and how the secretion occurs. So the insulin secretion occurs in the pancreas. The pancreas is a double gland, meaning that it has both exocrine as well as endocrine function. But the pancreas has a larger exocrine function because 99% of the pancreas cells are made of acinar cells. So these are systems of ducts which secrete or synthesize digestive enzymes. But then there's a 1% of cells which is dedicated for the endocrine function, and these cluster of cells are what we call the islets of Langerhans, and these are more abundant in the tail. And the islets of Langerhans are comprised of 4 types of cells. These are the alpha, beta, delta, as well as the F or the PP cells. Each of these cells have their own function, and then the beta cells will watch what we will be talking about, especially when it comes to insulin. So these cells in common will secrete peptide hormones, the alpha, beta, delta, and the PP cells. The beta cells, these are the most abundant cells, and they are situated in the center of the islets of Langerhans, and they are nourished by fenestrated capillaries. What the beta cells do is, in the presence of glucose, amino acids, or fatty acids, they detect the presence of these molecules, and then they secrete. Actually, they release insulin, so which we call secretion of insulin. But beta cells are not just secreting only insulin. With insulin, they also secrete this other molecules such as C-peptide, proinsulin, and amylin. An interesting thing is that insulin and C-peptide they're both released with the same concentrations. We will talk about how that happens when we discuss the insulin synthesis part in a little while. And then you have the alpha cells, and these are involved in the secretion of glucagon, and this is mostly involved in the mobilization of stored energy. So you can see increase of glucagon in conditions where there is a deficiency of nutrients. And then you have the delta cells. Their chief function would be to suppress the beta cell and the alpha cell function. And then you have the PP cells, and what they do is that they are involved in polypeptide synthesis, or pancreatic polypeptide synthesis. So you can always remember the function of delta cells if you just try to equate delta with something like death, which gives a ring of impedance, or impedance rather. So if you think of that, we could say, you can remember that the delta cells are involved in the suppression of the functions of beta cells as well as alpha cells. So the beta cells, as I told you earlier, is involved in the secretion of insulin, but not only insulin, but then C-peptide and proinsulin with amylin. The alpha cells are in charge of secretion of glucagon. Delta cells, they suppress the activity of beta as well as alpha cells, and the PP cells, like the name says, pancreatic polypeptide synthesis. And as I told you earlier, this here is a graph on insulin secretion. So we say insulin secretion is a biphasic secretion. So here, as you can see, if you look at the graph here, which is plotted against insulin secretion and the time frame, you can see two little mountains here. So the first mountain is a shorter mountain, and you have a much taller one here. The short mountain here is the first phase, where you can clearly see that the time taken to this elevation is less, and it's very rapid increase of insulin secretion. This is called phase 1. And then the second phase is where you have a much taller mountain, taller elevation, where the secretion is much higher, but also the duration for this is not as rapid as the um, first elevation here. So therefore you could consider this as the second phase. So this two phases of insulin secretion is what we call the biphasic nature of insulin secretion.